And now on the line is Angela King. Angela works for the HSE and she is the chair of the Building Safer Communities local steering group for the Canal Communities area in South Dublin. Angela, welcome to the FM.
Thank you very much, Darren. I'm delighted to be here. I'm delighted to be here talking about the Building Safer Communities programme as well.
Okay, Angela, we are recording this interview on Friday the 22nd and it will be broadcast on Tony's programme on Sunday. I know you have an event coming up in Rialto next Tuesday. Before we talk about that, can you tell me a bit more about your job with the HSC and your job as chair of the local steering group?
I can indeed, yes. So I suppose my role is Health Promotion and Improvement Officer with the HSE, and I'm part of a wider health and wellbeing team. So our job as a team is to work with people to increase the control over the factors that influence their health and hopefully to improve their health and wellbeing, both of the general population, but also maybe populations that are more at risk, particularly around chronic disease. So our work it's guided very much by national policy and strategy. So the Healthy Ireland framework would be the key overarching policy document we would refer to. And then in terms of our role as health promotion officers, our role is around enabling, negotiating, advocating and working with communities and working within the HSE and external stakeholders to make sure that we make the best use of the available but limited resources to improve the health and well-being of the population. And then in relation to my role as the chair of the Canal Communities, Building Safer Communities, the steering group, this started off as, first of all, I was part of the group, and then I became the chair of the group, and it's been an absolute privilege. And I suppose for me, I've seen some of the harm that alcohol does, both to individuals, but also in terms of, injuries on the road and death by suicide, where there's been alcohol as a factor. So alcohol is obviously something that's very important in terms of addressing the prevention and reducing alcohol-related harm. Also things like fetal alcohol spectrum disorder when alcohol is consumed during pregnancy. So these things are really, really important. And we've been collaborating in terms of our partners at community level in terms of prevention and harm reduction work. So that's really important to me, but also to our service. That's why my role includes that. But also, I suppose, for me, I've seen some of the changes that have happened as a result of people being able to access services, or maybe someone has had a conversation with them about their alcohol consumption and they've been able to get support through the HSE or through alcohol and drug services, and it's changed the course of their life for the better. So there's those real positive stories as well. So if we can help build that by what we do through this, it's very powerful.
Okay, that's cool. Okay, in terms of the Canal Communities steering group, I understand that you have a big event coming up in Rialto next Tuesday, the 27th. Can you tell me more about it?
I can indeed, yes. We have our launch of our Canal Communities, Building Safer Communities programme, preventing and reducing harm, alcohol harm, and this is a local launch. So this is the second of, there's going to be there's a national one last year, and there's a series of them for all of the different projects. So ours is the second one. The first one was in Letterkenny. So we're delighted to have this. The Building Safer Communities programme itself is a World Health Organization programme. It's a technical package, and we're delighted to be using it. So within the programme, SAFER, which is SAFER, obviously. So it stands for, the S stands for Strengthening Restrictions on Alcohol Availability. The A is to advance and enforce drink driving countermeasures. And the F is facilitate access to screening, brief intervention and treatment. So there are ways of approaching it if people have alcohol-related issues. And E is about enforcing bans and restrictions on alcohol advertising, sponsorship and promotion. And then R is around raising the price on alcohol through taxes and pricing policies. So some of these would be local, but then at a local level then we have different interventions. So we have the 15 different interventions, and Ireland actually is the first country to actually enforce this particular World Health Organization technical package to prevent and reduce alcohol harm. So it's a really exciting time for us.
Okay.
Yeah.
Okay, oh, that's cool. Okay, okay, Angela, I read a report on the RT News website on Wednesday that said that over the last 30 years there has been a significant reduction in the number of young people in Ireland who drink alcohol. This is fantastic, I think. Uh, can you tell me if you know any more about the report?
Yeah, I suppose the report is based on every so the European study that's called the European School Survey Project on Alcohol and Drugs, ESPAD, and that's conducted among over 100,000 students aged 15 to 16 over 37 European countries, and it was done in 2024, including in Ireland. And I suppose the idea behind the survey is that it monitors adolescent risky behaviour across Europe. And this year in particular, they've introduced a new focus on mental well-being and prevention activities. And it recognised the growing importance of them, I suppose, in terms of adolescent health. So there has been reductions reported in the survey from Ireland, which is good news. For example, around alcohol, 66 out of 100, so 15 to 16-year-olds who've been surveyed, had consumed alcohol in their lifetime, which is down from the 2019 figure, which was just over 72 young people per 100. So that's about a 10% decrease. And then there's been, reductions in terms of students reporting having been drunk in their lifetime and students having consumed alcohol in the last 30 days, and that's been down since 2019 as well. And then I suppose the concern here would be that this isn't the full story. It's not really the full picture because there isn't enough attention in the report given and the analysis given to kind of a wider picture around that. So whilst there's definitely been shifts and changes, and young people are definitely, choosing a more kind of a lifestyle which is free of alcohol. On the other end, unfortunately, there's more, there's young people involved with heavy, risky, independent drinking, and that's a real cause for concern. And there's also other drugs being used, but I'm not focusing on that one today. But I suppose in terms of what we're trying to do, the measures in the SAFER initiative look at restrictions on alcohol availability to reduce harmful use of alcohol, particularly by young people and other vulnerable and high-risk users, and also facilitate screening and brief interventions and treatment from the health services and our community partners, including the drug services. So hopefully some of those interventions will have a particular impact in relation to young people, particularly the ones that we're identifying there, that maybe there's a more risky pattern of drinking behaviour there.
Okay. I know you're saying there that the European report doesn't give the full story, and I know that a lot of young people do drink hazardously, but has been a reduction. I think the reduction in the number of young people drinking alcohol in Ireland is largely because of the enactment and measures to date of the Public Health Alcohol Act and work by yourselves and HSE and task forces and organisations like Alcohol Action Ireland and the Alcohol Forum. And do, do you agree, Angela, that the reduction is largely down to advocacy and work on the issue of alcohol abuse?
It's an interesting question, and I suppose there's nuances in this. Definitely, the Public Health Alcohol Act has been a really, really important public health measure in relation to alcohol and alcohol harm. And the collaboration that's been going on amongst the partners from, Alcohol Action Ireland, the Alcohol Forum, the HSE, our regional and local drug and alcohol task forces and the services has definitely been really, really important in addressing issues across the age groups, I suppose, in terms of alcohol consumption. And sometimes I think people might think the reduction of the number of young people drinking alcohol is down to the measures implemented by the Public Health Alcohol Act. But whilst there has been some impact in Ireland, there's been a drop in teenage drinking that we've seen across high-income countries over the last couple of years. And these countries they don't currently have a Public Health Alcohol Act or something similar to that. But as previously mentioned, there are concerns about heavy, risky and dependent drinking. So I suppose the advocacy work of organisations and the collaboration in terms of the Public Health Alcohol Act has been really, really critical. And as they say, there's more work done, but there's definitely, there's a lot of work done, but there's more work to be done. And I suppose in terms of research, the Health Research Board have a particular focus on alcohol in a survey that they did in 2022. in relation to young people. And I suppose some of the findings from that are young people are beginning to drink alcohol at a later age, again, which is good news. It's up from 15.6 years in 2022 to 16.6 years in 2019. But there's still problem drinking. It remains a main issue amongst 15 to 24-year-olds. And that's the stage, I suppose, in terms of development, in terms of brain development, which is really, really important. So we can't be complacent. And I suppose 1 in 3 drinkers aged 15 to 24 has an alcohol use disorder. And despite a decrease in the prevalence of binge drinking, adolescents in Ireland ranked 7th out of 35 European countries for reports on being drunk. And again, this is an issue. So we can't be complacent about any of this. And also there's been an increase in substance-related hospitalisations among young people. And so we know there's a clear link between mental ill health and substance use, including alcohol as a substance. And this is evident across, anxiety, self-harm and suicide. So I think we have definitely work to do, and the Public Health Alcohol Act is a really good foundation in terms of the legislation, but it's part of a package of measures, and I think that's, again, one of the measures from the SAFER around legislation and having having the backup in terms of measures and having the legislative framework for that.
Okay, Angela, can you tell me more about what the event in Rialto on Tuesday will entail on the day?
I can indeed, and I'd be delighted to. So basically, we'll be kicking off at 10 o'clock with the registration, and then we have 2 of our community choirs. So we have the Recovery Choir, and we have the oh my goodness, I hate that when you forget the name of something. The Harmonies for Health, which is a singing group in the community. So both these choirs are going to join us on today. So there'll be something at the beginning, and then we'll have the opening address, and then Anne Doyle from the Health Research Board, who's the research officer there, is going to give us an overview of alcohol research. Then we're going to have a background to the SAFER initiative and the national context from Orla Fagan, who's the national lead for the Community Action Alcohol Programme. And then we have, we're going to have 2 components of the SASER, which we'll have the Garda one with Dave Butler, who's the superintendent in An Garda Síochána. And then we have the HSE, Aisling Sheehan, who's the national lead for the Alcohol and Mental Health and Wellbeing Programme, who will take on the HSE component of it. And then we'll have some of the local context in terms of the work that's been done. So Canal Community has been involved in alcohol work for a number of years, and our Nora Byrne, who's our polydrug and alcohol worker with Canal Communities Regional Addiction Service, is going to give an overview of that with us. And then we'll have a panel with the Q&A session, and we're going to close out then with hopefully a song from Paddy Casey, and then a light lunch. So we're really, really excited about this. And yeah, so we'd welcome the opportunity to come back maybe in the future at some stage to let you know how we're getting on with the project as well.